right, we are at a moment in history, and there's plenty of misinformation out there. So we're taking your questions straight to the experts. We'll be doing this every night. You can tweet us your questions to @FoxNewsNight. We'll try to get them answered. Joining us now to help, Senior Vice President of Jeff Connect at Jefferson Health, Dr. Judd Hollander, and board-certified medical doctor, now part of the Fox family, Jeanette Nesheiwat. Good to have you with us, doctor, as well.
Thank you.
Okay, our first question comes into us from Sherilyn, who says on Twitter, can you get the virus from touching the grocery bags when you shop, or don't they cling to that type of surface? I'm paranoid, thinking I need to wash after I touch anything. Please advise. Thank you. I went grocery shopping today. Dr. Nesheiwat, we'll start with you. I was thinking the same thing.
Yes, that's a great question. It is possible for virus, bacteria, and fungal substances to live on inanimate surfaces. The likelihood of picking it up, however, from a garbage bag, a clean garbage bag or grocery bag, is low, even though it's possible. You're more likely to pick it up from another person, from coughing, from sneezing, from water droplets entering from one person into another person's eyes or nose or their mouth. So that's more common to pick up the coronavirus or any virus such as the flu in that manner versus from a grocery bag. But I would still advise, if you're going shopping and you come back in the house and bringing in a bag of groceries, you should still wash your hands.
Yeah, which I did, and then sanitize them as well. Dr. Hollander, anything to add to that about the grocery shopping, and also the idea of, I didn't know what to do about produce, because I was a little bit worried about that too.
No, well, I think we still need to go out shopping. We still need to get food. I think Dr. Nesheiwat's advice is perfect. I would just be careful about the time you go shopping and how crowded it is to be shopping, and know where the people around you are in the store. You're more likely to get, to catch a virus from somebody coughing or sneezing on or near you. And we should practice the social distancing that everybody's heard about and try and stay 6 feet away from everybody else.
Yeah, I was looking for bananas, and I'm sort of doing this turn to the side. Everybody's trying not to touch each other and kind of, horn their way around without getting in anyone's personal space. All right, Dr. Hollander, I'll start with you on this next one from Jig Dragonslayer. Says, if this virus is having almost no effect on people under the age of 50, why are we closing everything down? Shouldn't our focus instead be on the elderly and vulnerable instead of this sweeping response that hurts everyone?
No, the sweeping response is incredibly important, because you can get the virus and you could pass the virus on when you're asymptomatic. So you might be a 2-year-old that's really unlikely to have side effects, but if you go to your grandpa's house, they can get it, and it can be really serious for them. So it is really super critical to stop the spread early on, because the person who is concerned about getting it may transmit it to a really high-risk patient in the near future.
Dr. Nesheiwat?
Yeah, absolutely correct. And, even though we see most of the illnesses in our older population with underlying medical disease, you can still be, in your 30s or your 40s or even your 50s and still, end up in the hospital.
Yeah.
I've seen that happen, and especially if the younger population are smoking or vaping and not taking care of themselves. So we're all at risk, even though there's a higher risk in the older population.
Yeah, it doesn't just mean if you're under that age limit, you're going to be fine, because we've all seen and read about those cases. Okay, our next one comes from Kenny Bird. Question, if you've had the coronavirus, can you get it again? And can you have the flu and the coronavirus at the same time? Dr. Hollander?
So we have not had coronavirus around long enough to know, but I think most people suspect that this type of coronavirus, once you have it, you probably won't catch this coronavirus again. Kind of like the flu.
Yeah.
You won't get the same flu a second time, but it'll be slightly different next year, and you can be prone to it again. It is theoretically possible to have the coronavirus and the flu, but that is incredibly unlikely. And so one of the testing algorithms that we widely use is that if you test positive for the flu, we don't go on and test you for coronavirus because you think it's so unlikely that you have it.
Dr. Nesheiwat, it seems like same protocol.
Exactly. If a patient comes in, and I swab them, and for example, I just had this last week, he tested positive for influenza A, and we stopped right there, put him on some antiviral medicines. I still said, look, you need to go home and rest, and we told him, take at least a week off, wait, and then once you're better, another day or two, and then go back to work when you're completely asymptomatic without fever.
Okay. For a lot of people, there's going to be a lot of downtime because that's just the way it's going to be for a while. Okay, Eric Coleman writes in, can the test detect coronavirus before you have symptoms or only after a certain amount of time has passed with the disease? Dr. Nesheiwat, we'll start with you because I know that it seems like the only way you would get tested asymptomatically is if you had a family member or somebody that was already confirmed to have coronavirus. But I have heard of these people who never had any symptoms but had a family member, so they were tested, and the people who were tested and that were asymptomatic did have coronavirus.
Yeah, so it's possible to absolutely test positive and be asymptomatic. Or some people may have such mild symptoms they don't even realize what's going on. But usually you would see if someone with a fever and runny nose, cough, shortness of breath, they might be more likely to have a clear positive earlier, but it's definitely possible to test positive and have no symptoms. And we're already seeing that with many people. Even, for example, we saw some recent basketball players who were asymptomatic but were exposed to some of their teammates and went and had testing out of an abundance of precaution because there was concern that they were going to spread it to hundreds and hundreds of other people.
Okay, Dr. Hollander, this one I thought was very interesting. I hadn't thought about this, but this comes into us from Roxy, who says, any advice for expecting mothers? Should they be considering a midwife, or will the hospitals be okay to handle the deliveries? Thanks.
So I think at this point in time, we actually fortunately don't know of any adverse outcomes on pregnancy. It doesn't appear that there's a higher rate of miscarriage. It doesn't appear that there's a higher rate of complications. And it doesn't appear that there's a higher rate of fetal anomalies. So we think pregnancy can proceed just like pregnancy would with other conditions, where we want mom to stay well, we want mom to be hydrated, we want to make sure that mom feels okay and isn't sick and dehydrated. But in terms of when delivery comes, we don't know anything different that needs to be done.
Okay, and we talked about this a little bit last week, the thought that plasma, at least in some places, it worked to use plasma from people who were fully recovered on people who were then suffering. So Felicia Byron writes in about this. Is plasma from recovered COVID-19 patients effective in treating current infected patients? Dr. Nesheiwat, any news on that front?
Yeah, so it's called passive antibody therapy. And, hey, anything we can try at this point to try to keep patients alive and well as a last resort while it's still undergoing tests, I'm all for it. So in theory, it could help, because what you're doing is taking the blood from someone who has recovered from the coronavirus. So usually when you have an infection, your body can create what's called antibodies, which can protect you from future infections. So that's the theory behind it, is using that protective mechanism, injecting it into patients who are currently symptomatic and currently trying to fight the virus, and to see if they can have some relief and recovery from it. So I think it's hopeful, in addition to the current medications that are being tried right now.
Okay, and our last question to you, Dr. Hollander. Sherry Sturgeon writes in, as a healthcare provider, I'm curious if when we're exposed to known COVID-19 positive patients, will we have to self-quarantine? If the hospital staff is going to have to be put out for 14 days after exposure, we will quickly have no one to care for patients. Thoughts?
Yeah, so that is a real big problem, and I'm going to address that in a little bit of roundabout way, which is exactly why, as you introduced me, my title has to do with telemedicine. We don't want people who aren't sick to come to the emergency department, and we don't want people who aren't sick to come to urgent care centers or primary care offices, because we want to decrease spread. So one of the ways we can maintain the workforce is having the people who are sick stay home and get testing. And what we're doing at our shop is we actually have people calling our app, Jeff Connect. They'll see a doctor like me, like you see me on TV right now. I'll be able to examine you, and I'll be able to set you up for testing in a secure environment where you don't expose it to other people, and that will preserve the workforce.
Yeah, and I think we're going to see a spike in telemedicine. That may be one of the new things to come as a fallout from this. Dr. Hollander, Dr. Nesheiwat, thank you both for your time and expertise. We appreciate it. The best to you.
All right, thank you for having me.